Hello, it's Marek Purczyński, and today I tell you something about degenerative disc disease. It is really common department and a really common problem with human body and actually human spine. A lot of people has got the disc issues. Why does it happen so often, and why does it happen actually now more and more early with everyone? The problem is the gravity, and actually the force of gravity always squeezes our spine. Our discs lie in between two vertebrae, and when the tension and when the pressure of the gravity is too high, because the spine actually doesn't move at all, when we sit, when we actually spend a lot of time in static positions, we start to have a problem with disc dehydration. What doesn't happen and what doesn't mean? It means that water comes of the intervertebral disc. Why is it so important? Why? Because the disc contains about 60 to even 80% of water. And this water provides our disc vitality and proper function. If you lose that water from the disc because there's too much pressure on your spine, your disc starts to degenerate. Actually, it's getting less and less elastic, and it starts to rip apart. From the beginning, from the actually more lateral side, then it goes more and more interiorly. When your disc finally rips apart, the nucleus pulposus, which is actually fluid from inside of the disc, comes off and can irritate the roots, actually nerve roots, and can block the whole spine. How to prevent it, actually? Most important thing, obviously, is to move. Stop spending a lot of time in static positions and standing still or sitting still on the chair, for example, at the computer. So important thing is to move and to stretch. If you stretch a lot, you will have little less problems with your spine. But most important thing is rotational movement of the spine. Exercise is very simple, and you can try to perform it actually every time. No matter how advanced your problem with your back are, this exercise will not harm you. It's really important. Try to lie on your back. Your both shoulder blades lie on the floor, and from this position try to bend your hip and your knee, and right now twist your hip and the knee, which means whole leg, to the opposite side. Try to hold your scapulas on the ground all the time. You can grab something heavy to this hand, actually to keep the balance. And right now you try to relax, and you try to create the tension which is coming from the side of your hip to your medial glute and to your thoracolumbar fascia, which is on the back. Try to breathe deeply, relax. As you see, I put my hand on the knee, which helps me to bring the knee a little bit further down. I breathe, and right now I stretch all muscles and fascia, which will be actually too tense when I have the back problems and back pain. But most important thing from inside is that I create that suction force on my disc, and I twist whole spine to the side, which really helps and really cures the spine. I try to stand and try to hold this position for 2 or 3 minutes. I shouldn't feel too big tension. If the pain is too great, too big, I try to go back a little bit. Obviously, you try to perform this exercise for both sides. And what I have to tell you from my experience, sometimes when I have got the back problems, I always do this exercise, and it really helps me. So actually, help yourself if you want to. Thank you.